I'm super excited about today's video. I'm going to help you understand how to use your medical insurance to pay for HRT and help you find providers that accept insurance and are affordable as it pertains to your possible out-of-pocket costs. Hi friends, I'm Peggy with Hormone Therapy Hub. Let me help you navigate where to start your hormone replacement therapy journey. See a link in the comments for my preferred list of providers in my Hormone Therapy Hub website. So your first question might be, can I use my health insurance for hormone replacement therapy? Yes. If you have health insurance, there are many FDA-approved bioidentical products that can be prescribed to you to alleviate menopause symptoms. I'm not sure why, but I always assumed my insurance, which is a benefit to me from my full-time employer, wouldn't cover the cost of HRT. Clearly, I was wrong. For 4 years, I paid out of pocket for my HRT because I never really did any homework or looked into how this might work. Your second question might be, is hormone replacement therapy covered by insurance? The most difficult part of getting your hands on HRT products that your insurance will cover is finding an HRT specialist or hormone replacement company who accepts insurance and know which products insurance will cover. The good news is that as of today, there are 2 super great online HRT companies that accept insurance and will write prescriptions for HRT that are known to be covered by prescription insurance. Those 2 companies are Midi Health and MyMenopauseRx. MyMenopauseRx and Midi Health have a lot in common, but one is the clear winner at the end of the day as it pertains to your out-of-pocket costs, so keep listening. Your next question might be, so what does it cost for a hormone replacement therapy initial consultation? Well, the first thing you have to determine is whether your insurance would be considered in-network or out-of-network. Both of these providers accept some of the biggest names out there like Aetna, Blue Cross Blue Shield, Cigna, Humana, United Healthcare, Blue California, Anthem, HealthNet, and TRICARE. If your insurance is one of these providers, then you're likely golden and you can move on to the next step. Your out-of-pocket cost for the initial consultation will be based on where you are with your annual deductibles and any copays that you are responsible for. It will work just like it would with any other doctor visit that is considered in-network. If you learn that your health insurance is out-of-network, which is what happened to me when I became a patient of Midi Health, my insurance company informed me that the $250 for the initial 30-minute consultation fee would be considered out-of-network, and that the $250 would be applied to my out-of-network deductible, meaning even if I submitted the claim, the $250 would go towards the deductible, and I wouldn't see any money reimbursed to me. Midi Health offers first-time patients a 30-minute consultation for $250. They will bill your insurance, and then you'll later learn at a later point what's expected of you based on your copay and your deductible. MyMenopauseRx offers a 20-minute consultation, and if you don't have insurance or if you learn your insurance is considered out of network, they have a self-pay option that only costs you $99 for that first visit. So that's $99 versus $250 with Midi Health. In either case, you can contact MyMenopauseRx or Midi Health to determine your out-of-pocket costs and estimates before you commit to one company or the other. Once you make a decision on which provider works best for you, you will create an account and provide the needed medical information and history. They'll send you a link to their patient portal where you can schedule your initial consultation. So your next question might be, are hormone replacement therapy prescriptions covered by insurance? Yes. The clinicians at both Midi Health and MyMenopauseRx are very familiar with what prescriptions health insurance will cover. They are aware of the FDA-approved formulations and the dosages that have been approved. This is one of the biggest differences between a company who accepts insurance compared to an online provider who expects you to pay out of pocket. In many cases, the companies who offer self-pay products are prescribing meds and dosages that may not necessarily have been approved by the FDA. At the time I met with my clinician, I was on an estrogen patch and a progesterone pill. I was paying out of pocket and was curious and hopeful that it could be prescribed, that they could prescribe the same formulation and dosages or something similar, and that my insurance would cover the cost. And it did. I shared with my HRT specialist that the patch dose I was on, along with the dosage of the progesterone pill. She was in agreement and duplicated the prescriptions and sent them to my local pharmacy for me to pick up. Initially, I used my Express Scripts prescription insurance provided by my full-time provider. The average monthly cost for the estrogen patch and the progesterone pills were $69.38. After doing some research, I realized that if I used a GoodRx coupon, the cost was even lower than when I used my prescription insurance. That made no sense to me. The GoodRx coupon takes the average monthly cost down to $33.58 per month, not including any of the visits or consultation fees. Next question, can they help you with weight loss? Absolutely. If you were like me, menopause brought on the dreaded night sweats, hot flashes, and 25 pounds that I couldn't seem to get rid of. Both of these providers can write prescriptions for Wegovy or Ozempic to help you with midlife weight that seems to creep on with so many of us during this stage of our life. They also offer skincare, hair loss products, and products to help with sexual health. Menopause doesn't just affect one part of our body, it affects our entire body and impacts each of us in a different way. No two of us are alike in how menopause will be hitting us. So you also may be asking, MyMenopause versus Midi Health, which is more affordable? There is so much similarity between these two providers, but there are a few ways that they differ. So first, Midi Health's consultation fee is $250, and if you are paying out of pocket because your insurance is out of network, that's a hefty fee. If this ends up being your situation, you can go to MyMenopauseRx and ask to be charged as a self-pay patient, and the cost will be $99. However, if you've experienced one of those years where you met your deductible and your insurance is in network, your cost for the initial consultation may be minimal, if anything. 2, consultation visits with MyMenopauseRx are 20 minutes in length. Midi Health offers their first-time patients a full 30-minute consultation. When was the last time you were afforded 20 or 30 minutes with a healthcare professional to discuss your medical needs and questions? And then the third differentiator, Midi Health, from what I can tell, employs mainly physician assistants and not so many real doctors. So it's likely you won't be seeing a real MD, and maybe that doesn't matter to you. On the other hand, MyMenopauseRx has MDs, certified nurse practitioners, and RNs. So regardless of your needs, they have a full staff to serve you and your menopause needs. They even have a physical location in Wheaton, Illinois, if you happen to live in that area. Based on the way they practice, both companies, the only real differentiator is the cost of the initial visit. And so based on that alone, MyMenopauseRx is the more affordable, specifically as it pertains to that initial consultation fee to get your hormone replacement journey started. I hope this video helped. Leave me any comments if you have questions.